All right, great. Well, thank you everybody for joining today. I'm Nimish. I'm going to be leading our webinar today. Just a couple of admin items before we go ahead and get started here. The first is I'm going to be covering some materials today. We'll leave plenty of time towards the end to answer any questions that folks might have, but please feel free, if anything comes up, drop it into the Q&A, and I'll be sure to go through those at the end, but also as we're going through the materials in case there's certain questions that show up on each of the slides or the materials that I'm walking through. The second thing is we are going to be recording the session today. And so after we have completed the webinar, we'll be sending the recording to everybody that's participated. That way, if you have folks on your team that weren't able to join us, or you'd like to go back through the material, we will be providing you with a recording. And so with that, I want to go ahead and dive in. Again, appreciate everybody taking the time this afternoon or this morning to join our webinar on the individual coverage HRA. As I mentioned, I'm Nimish Shukla. I am the co-founder and COO at Liferaft. I've been in the insurance space now for about 10 years, and this is now my second insurance technology company. Prior to this, I started a company that was acquired by MassMutual. I'm incredibly excited to be sharing our materials and an overview today of the individual coverage HRA. It is an account structure that we've seen a lot more of in the health space, particularly. And so what we're going to cover today, I'll start off by really providing just a brief overview of what an HRA is. We'll talk specifically about one use type of the HRA, the individual coverage HRA, which we've seen a lot of adoption of for groups that are really looking to save costs on their major medical or their group health insurance. I'll talk a little bit about how our platform would work in the event you were interested in an HRA, and then walk you through a couple of customer case studies, really to illustrate the value of the HRA and how it's used by businesses today. So let's go ahead and jump in. I want to start with what is an HRA. And so, really think of an HRA as a tax-advantaged way for you as an employer to be able to offer money to your employees for certain health expenses. And that can include health premiums, but it can also include a wide range of other expenses. And so, today, most benefits are offered through insurance products. We are offering one or two types of plans that are available from a group health insurance provider. With an HRA, you are actually giving people money directly at your company for them to be able to buy the health insurance that they want. Or you are providing a monthly reimbursement or monthly allowance for your employees to be able to go get the care that they want, where it may not be covered by the health insurance that you have, or there's a deductible related to it. So think of this really as a health stipend that you're able to offer your employees in a tax-advantaged way. Now, what are some examples of expenses that can be covered? As I mentioned, health insurance premiums can be covered. If you have folks that are turning 65 in your workforce, it can also be used towards Medicare Advantage, Medicare supplement premiums. But it can also be used for a host of expenses like money that your employees are spending on their copays or a deductible that they might have with a health insurance plan. Or you can also cover expenses that aren't typically going to be covered by health insurance. So things like IVF related experiences or expenses are one that we're seeing quite frequently, where businesses are contributing a portion of money towards IVF related or reproductive care related expenses. So really, really flexible account structure that can be used to really give your employees something of value towards health expenses that they might have. So, when we think about what the HRA is and really why you might want to use an account like this, what are some of the advantages? So I want to start with employers, right? So for the company, the first is it really is an efficient benefit spend. And what we mean by that is you set a budget of how much you want to be contributing towards your employees' health expenses, whether that's premium or other expenses. And you just are deploying those fixed dollar amounts towards the expenses that your employees may or may not have. The second thing here is it is the money for the HRA. So what you're actually using to fund the expenses your employees are going to have is through your general account. So you don't have to set up a separate escrow or a separate plan. We help you design the plan. We set your budget, and then you're using the funds in the company's bank account to cover some of the costs that your employees have. Now, what that does is, number one, any money that's used through the HRA, so any money that is used to reimburse your employees for expenses, is going to be a benefit deduction. And what does that mean? When your company goes to file its taxes at the end of a year, there's a benefit deduction that's going to lower the amount of income that's used to calculate the corporate taxes that are paid. So it's tax efficient from the company's perspective. The third bullet point here is really expenses based on utilization. And this is a big one. So I'll take a minute to kind of walk through what that really means. You as a company set a budget. Let's say that is $100 per month per employee. How much you are actually spending is only based on real employee utilization. So if every employee has expenses to use the $100, you would be spending the $100. If in a month there are no expenses because employees haven't utilized the HRA, there would be no expense to the business in that month. And so rather than today where you're paying a percentage of premiums, this is really going to be only based on how your employees are utilizing the HRA account that you set up. But also for employees, there are a lot of benefits to the HRA. So the first is these are tax advantage dollars. And what that means is any money that your employees receive through the HRA, whether that's for health insurance premiums or for other expenses, those are going to be tax-free to your employees. And so they're not included on the W-2. And so your employees are getting tax-free money to be able to use towards health expenses. The second and the third bullet point are connected here. Rather than giving your employees a network or access to an insurance product, the HRA really enables employees to receive real dollars to spend on health services and from the providers or through the systems that they would most like to. So a big thing that often comes up with group health insurance is I have this doctor, they're not in network for the group health insurance that my employer is providing me. With an HRA, your employees actually get dollars towards the services that they want. And so they can go see a doctor that they want, or in the case of an individual coverage HRA, they're able to find a plan that's best suited for them that may include that provider. And so really, really flexible, a lot of advantages, both for the employers, but also for employees as well, when thinking about utilizing an HRA. Nick just asked, are all employees typically eligible, or can you reimburse specifically for health insurance premiums, meaning only those that don't have health coverage elsewhere are eligible? That's a great question, Nick. I'm going to talk about that in just a second with the individual coverage HRA. One thing to keep in mind is, and I'll talk about this in a moment, the offer of an HRA has to be made to eligible employees within a class. So there is some flexibility in terms of who is offered an HRA at your company. We work with our clients to be able to really define what's called a class there, but it does have to be offered to everybody within that class. And so I'll get into that in just a moment here. But briefly, before we talk about the individual coverage HRA, I want to talk about what is and what can't be covered with an HRA broadly. So an HRA does have a very long list of things that can be covered, but really think of this as any expenses that are directly health related. And so again, that could be premiums, right? But it could also be prescription medication. It could be copays for physical exams. The need for medical devices can be covered. As we mentioned previously, reproductive care services can also be included in what the HRA will cover. In terms of what they won't cover, it's really going to be anything outside of the traditional kind of health expenses. So things like teeth whitening or cosmetic surgeries or certain types of counseling like marriage counseling, those are not going to be covered with the HRA. So let's talk about the individual coverage HRA, and then we can talk about some of the details around how you might offer an individual coverage HRA. And very briefly, Amy just asked, is general dentistry covered? That's a great question. Yes, it can be. So both premiums for dental insurance can be covered with a type of HRA, but also direct expenses that your employees have towards general dentistry can be covered. Diana asked, are elective surgeries covered? Great question, Diana. They can be. It's really going to depend on the type of surgery and how you as the employer want to structure your HRA. But they can be covered in the HRA. So great. I want to talk about the individual coverage HRA. That's where we're going to spend most of our time today. And really talk about some of the trends that we're seeing in terms of adoption of the individual coverage HRA. What are the accounts, and really why are businesses starting to transition from group health insurance to the individual coverage HRA? So the individual coverage HRA, or the ICHRA as I'll call it during our webinar, is an HRA account that allows an employer to offer or reimburse employees for health insurance premiums. And so in this instance, employees are selecting and purchasing individual health plans through their state exchange or what's called the federal exchange. And the employer is reimbursing them for either a portion or all of the premiums that they are paying to get that health insurance. So think of it, today in the group health insurance, you have probably a broker or you're working in the small group market. You're getting a quote from different insurance companies for a plan configuration, right? Maybe one, maybe two. You have a high deductible version and you have a slightly more expensive gold version. And your employees then during open enrollment are offered the option to enroll in these two plans. With an HRA, that process is you're offering a budget. As a very simple example, I'm going to offer my employees $500 a month towards health insurance. And each employee is going and finding and selecting, and we help with this at Liferaft, but employees are able to enroll in an individual plan for themselves or for themselves and their family. And they are selecting those plans and receiving that $500 a month towards the premium that they would pay to get that health insurance. And so a slightly different version here. Why are people thinking about using an ICHRA, and where have we seen the most real value here? So number one, flexible options for remote teams. So this has really been a growing use case, obviously, given the COVID pandemic. Most of us are either hybrid or fully remote teams. The challenge today with group health insurance is if your company is headquartered in, say, California, and you have remote employees across the country, what is happening in the group market is you're usually having to select one PPO option that's available in California, and then all of your remote employees are having to enroll in that PPO option. And what that means for the employees is generally there's going to be a tighter network, so less availability in terms of providers that they may want. And it's not always the best plan fit for your employee that lives in Nebraska to be on a California-based PPO. With an ICHRA, the beauty of it is each of your remote employees are selecting and enrolling in plans that are tailored to their zip code. So your folks in Nebraska are going to be purchasing health insurance that is really tailored for Nebraska. So availability of doctors, the size of the network, the coverage is going to be really localized towards your employee zip codes. And so your folks in Nebraska are going to enroll in different plans than your folks in Texas or your folks in Ohio or your folks in California, because the plans are going to be different, the networks are going to be different, and they're really going to be tailored to your employees based on their geographies. And so the ICHRA really enables you as an employer to be able to fund a portion of those premiums as your employees go and find the coverage that works best for them in their geography. The second is, for companies that have not offered benefits previously, offering benefits, as you all know on the call, can oftentimes be an incredibly onerous process, having to go through renewal, getting a number of quotes from different carriers, working with a number of different brokers. An HRA or an ICHRA specifically really streamlines that entire process. So if you've never offered benefits before, you set a budget, you give everybody monthly allowance towards purchasing health insurance for themselves. It really, really dramatically simplifies the process of being able to offer your employees something towards purchasing health insurance. And the third, and this has really been the big one that we've seen, is really, really large cost savings. So I'll talk about this in more detail, but in many states, we're seeing the rates for the individual market, so those exchange plans, are more affordable or cheaper than those that we're seeing through group health plans. And so what does that mean for you as an employer as you're thinking about a potential transition from group health insurance to the ICHRA? It really means that there's a potential for pretty significant cost savings at the company level here. The second thing is, as groups, what we've seen is, year over year, groups are getting hit with these re-rates. As you go out and you talk to your broker, hey, we're getting another 10 to 15% rate increase this year. Is there any way for us to contain that cost? The ICHRA is going to be a really, really, I think, attractive solution, and probably the best one out there for you to be able to save costs if you're continually getting hit with those rate increases. So we had a couple of other questions pop up. So I'm just going to take a look at those and walk through them. Someone asked, to be clear, this reimbursement is tax-free to the employee and tax-deductible to the employer. That is absolutely correct. So employees receive those tax-free. It is not added to their W-2. For the employer, it is a benefit deduction when they're filing their taxes. Somebody asked, what are the metrics that indicate a company is best suited for an ICHRA? Number of employees, average age of employees, number of employees that are high risk, localized versus dispersed employees. That's a really, really great question. So what we've seen is the ICHRA is actually a pretty flexible account where there's value across employee base size. What I have seen is companies that oftentimes have 50 or less, there is a pretty significant 50 or less employees. There's a pretty significant cost saving that can be driven even at that size. As you get larger, the cost savings. Thinking about companies that have remote teams. So if you have employees that are really dispersed across the United States, and ICHRA is going to be a really good option. But really, I think the key here is we can take a look at different companies and see if an ICHRA makes sense. And I'll talk more about what that process looks like and how we do that. In terms of employees that are high risk, one of the things to keep in mind here as I look at the next question, is this self-insurance with a twist? What's the difference versus using a captive? It's a good question. So this is not really self-insurance with a twist. There are companies out there that are level or self-funded group health plans. And when you have a very, very large company, oftentimes there can be a lot of value in that. But if you think about and break down health insurance at its core piece, really what that product is, it's a pool of health risk. Now, for companies today, if you have a couple of people on your group health insurance that are high utilizers, right? So people that are either that are using health insurance a lot, what you're most likely finding is that when you go into renewal every year, your broker is coming back with a rate increase year over year because you have a few people on your group that are continually utilizing health insurance at a pretty high rate, which means the insurance company is going to be passing along that cost to you as the company and the HR decision maker. With an HRA, really what you're doing is you're taking your pool of risk, which may be, let's say, your 30 employees, and you're actually moving them into the individual market through the exchange plans. What does that mean for you as a company? Number one, there's more cost predictability because you're not going to go into a renewal season every year, and the insurance company isn't going to look at your utilization for your 30-person company and decide that there's a 10 to 15% rate increase due to utilization. Your employees are now a part of the larger pool. The second thing is this is really a reimbursement mechanism for your employees to find a fully insured plan. So this is not level funded. It's not self-funded. With self-funded and level funded, those plans really still put a lot of that health risk and the realized utilization on the P&L of your company. Here, you set your reimbursement. Folks go and buy the health insurance that makes the most sense for them. Diana asked, don't employees find it very cumbersome to research and secure their own coverage? I think this would not be well received, even if it means they save money. Great question. They can. I think it can feel daunting to be able to have to find your own health insurance. The great news is, as a part of our platform, that is actually something that we are very much involved in. So both with our technology and our platform, but also the fact that we have a number of licensed agents, we actually assist every employee at every employer that we work with to both find a plan that makes the most sense for them with their prescriptions, their zip code, their demographic information, what doctors they may want to see, and then we can actually assist in enrolling in those plans as well. So while it can feel like that, we provide the assistance to help you employees, one, understand the HRA, but then also number two, find the plans that work best for them and their individual health needs in their geographies. Great. Bernie asked, is the IC plan used by self-insured companies over 500 employees? Absolutely, Bernie. So we've seen companies even over 500 look at the ICHRA structure. It really, if they're self-funded, it's really going to come down to what their utilization has looked like and what that's doing to their stop loss premiums. So I have a number of groups that are larger that have found, their participation in the plan has varied over years, but when they get a couple of high utilizers, the same thing applies in a self-funded model, right? If you're fully insured, right, so you're not taking any risk as an employer, utilization is going to drive your premium up for the actual health insurance plans. When you're self-funded, there's still a cost component, really that's twofold. Number one, your stop loss is going to have a cost share component for the company. And that number is probably going to continue to go up if you have employees that are utilizing your health insurance at a high rate, right? So that means, what does that mean? That means your budget as a company is going to continue to go up. But then number two is you're thinking about the stop loss premiums that are paid that really sits behind your self-funded plan. Those stop loss premiums are also going to go up when you have utilization. And so it's certainly a model that can work in that space. The thing that I always tell everybody is that there is application in all of these, even in the self-funded space, larger groups. However, it's not always the right fit, right? And so really what I encourage all of you is, if it feels like something that could be interesting, we are happy to take a look at the specifics of the plan that you have today or the plans that you have, what the cost has been, and then really look at whether an ICHRA would be a valuable solution here. And that's going to depend based on the cost, based on the plans that you're offering today, your employee base. There are a lot of factors that go into it, but it's something that we can really help evaluate for both business owners and HR decision makers. Great. Jason asked, the function of reimbursing employees for medical insurance premiums, is that limited to ACA compliant plans for groups over 50? Or is it still considered in compliance if the employee uses a reimbursement for maybe a short-term medical plan or some other plan that is not ACA compliant? Really, really good question, Jason. So it is going to be limited to ACA compliant plans for groups over 50. So if you are an ALE, so you have more than 50 or more FTEs, you are going to be subject to the ACA regulations. The HRA, or the ICHRA specifically, is going to be ACA compliant, both for Schedule A and for Schedule B. However, the employees must be using the reimbursements that they get from their employers to be able to, to purchase plans off of the individual exchange or off exchange. But those are going to be ACA compliant plans that are going to make you essentially, it's going to help with the A and B penalty as well. So that was the next question we got. Does an employer still have exposure to the A and B penalties since they're not offering affordable coverage? So great question. With the ICHRA, there is affordability actually baked into how the ICHRA is structured and designed for your reimbursement schedule. So I'll talk about more about that in just a moment. But for those of you that are thinking about, does the ICHRA work for A and B penalties for the ACA? It absolutely does. So I want to talk about some of the cost savings that we're seeing across the US, and really double down here and hone in a little bit. So as I mentioned, one of the big kind of use cases that we're seeing in terms of why companies are switching to an ICHRA has really been in states where individual coverage is significantly cheaper than group health insurance. And so you can see across the country here, there are a number of states where that savings rate has been pretty meaningful. And so states where we've seen a lot of, one, really high quality plans on the exchange, but then number two, this cost savings. And so states like Minnesota, states like Ohio, we've seen a lot of clients in states really make the transition to the ICHRA because they're able to get their employees high quality coverage through the exchange, but also are really creating meaningful savings at the company level. Now, this answers a few of these questions around the A and B penalty, but also some of the requirements and features here. So ICHRAs are available and can be used by employers of all sizes. So whether you have one employee or you have thousands of employees, an ICHRA can be utilized for those companies. Now, it may not be right for all of them. However, again, we take a look at that and can let you know whether there's application and value in utilizing an ICHRA. But the important thing here is that it is a flexible account that can scale up and down regardless of the size of your company. Now, the second is that employees are going to be, and this goes back to a question that we had, they are going to have to be covered by individual insurance or a Medicare plan, whether that's Medicare Sup or Medicare Advantage, to be eligible for the reimbursement. So now that can be on exchange or it can be off exchange, but it is going to have to be an ACA compliant individual insurance plan that they're enrolling in. The third is, and I think this is a really strong really strong feature of the ICHRA is that there are no minimum enrollment requirements. So for those employers out there that are thinking about how do I stay ACA, Schedule A and Schedule B penalty compliant, it's around the offer of the ICHRA. And so what that means is you have to offer the ICHRA to everybody. Not everybody has to participate for you to remain compliant. But there's also no minimum enrollment hurdles here. So one of the things I've been seeing a lot, I just worked with a company actually about a week ago to get all of their folks moved over to an ICHRA. They have just about 50 people. They've been struggling with participation. They went out to renew their group coverage and they couldn't get a group plan. And so we moved them to an ICHRA because they were struggling with that participation rate. Because there's no minimum participation requirement or hurdle here, it makes it also a really, really great solution for those companies that need to offer health insurance, but aren't quite sure if they're going to hit the participation requirements or hurdles that are usually set by group health insurance plans. And the last one, I think, is, you determine the reimbursement limits. Now, you can decide how much you're going to be reimbursing and how frequently. Now, if you are an ALE, right, so you have more than 50 or more FTEs and you want to ensure the ACA compliance, that does have an implication for how your reimbursement limits are going to be set. We're going to have to set your HRA, your ICHRA reimbursements such that your reimbursement is deemed affordable in the eyes of the ACA. But again, as a part of our platform, that's actually something that we help all of our clients with, which is setting the appropriate reimbursement limits within your budget, but one that's also going to keep you compliant with the ACA. Great. So Amy asked if an employee is covered under a spouse's plan, could ICHRA funds be used to pay for those premiums? Great question. Unfortunately, it cannot be used if somebody is covered under a spouse's plan. So the ICHRA for employees has to be, if accepted, the employee has to be enrolling in that plan. Now, they can add their dependents, but HRA or ICHRA funds cannot be used towards covering a plan that is that's enrolled in through a spouse. Diana asked, can we create a class of employees based on their location? For instance, all California employees get HRA, while those in New York are eligible for our traditional plans. That's a really, really, really great question. Absolutely. So with the ICHRA and the HRA, the IRS does have classes of employees that can be used to determine who is receiving an offer for the HRA or the ICHRA. So for those of you on the call that have maybe two geographies where your headquarters are in California and you have remote employees in other states, you can actually class your employees within certain size restrictions. So if you are 100 or under, 100 FTEs or under, a minimum class size is 10 people. But you can utilize the classing to offer an ICHRA to certain employees while offering group health insurance to others. So here's how I've seen it used most frequently with our client base. And Diana, you actually laid this out wonderfully. We have clients that have in headquarters, let's say in California, they've got 20 people there and they've got another 20 people that are remote. Those meet the minimum class size definitions. So in California, because those plans are tailored to California, they keep group health insurance in California, but then for anybody that joins a remote, they're offered an ICHRA so that they can actually enroll in plans that are going to be a good fit for their geography. And so absolutely, you can utilize the classing to be able to offer not only group health insurance in one location and ICHRA elsewhere, but you can also use the classing to set different ICHRA reimbursement limits. Because plans are more expensive in certain states, you can actually reimburse. Again, if you meet the class sizes, you can reimburse employees in certain states more to be able to cover the greater cost. Great. Somebody asked, my company is a partnership law firm. Partners are owners, K1s, not W2. So would they be a class that exempt from the ICHRA? Yeah, absolutely. That's a really good question. So here's the one thing to keep in mind here. ICHRA is, if your company is a pass-through entity, so whether that's an S Corp or an LLC, anybody that owns more than 2% of that pass-through entity is going to be considered an owner and is not eligible to participate in the ICHRA. Anybody that has no ownership but is an employee of that pass-through can participate in the ICHRA. If you are a C Corp, everybody can participate regardless of ownership, as long as they're a W-2 there. So to kind of rehash again, pass-through entities, S Corps, LLCs, anybody that owns more than 2% is ineligible to participate in the ICHRA. They cannot participate in it. With a C Corp, everybody can participate in the ICHRA. Great questions. So I'll spend just a couple of minutes talking through what our platform looks like with HRA accounts. How would you actually administer this? And then I'll walk through a case study of a client, really that to help illustrate the value of utilizing an ICHRA here. So what do we do at Liferaft? Our technology and our team is really focused on allowing employers to be able to design, implement, and then administer HRA accounts. And that includes the ICHRA. And so really where we start is figuring out what your company's goal is, whether that's offering coverage to remote employees because you have a distributed team, whether that is saving costs because you continually getting those rate increases when you go and get your group health insurance quotes, or if it's a different goal. We start there and we really then design what your ICHRA would look like for your company. And when I say design the ICHRA and what it looks like, what I really mean is understanding what the reimbursement limit should be, again, both for your company's budget, but also then ensuring affordability, understanding the geography, and if we need to change those reimbursement limits based on where your employees are located. And also some of the other features include whether or not you want the money to accrue month over month, right? Do you want to include just health insurance premiums for coverage? Do you want to include other expenses? So we really work with you to design the plan that is the best fit for your company and for your employees. And once we've done that, we then will do all of the legal and we establish the actual HRA plan for your company. So the legal documentation that goes into that. But then also set you up with a platform that's going to allow your company to utilize the ICHRA. And then on a monthly basis, we give at the company HR admins the ability to review reimbursements, adding employees, offboarding employees. And also, one thing I should mention is that our platform can actually effectuate the money movement. So we've automated the reimbursement process such that for you all as decision makers or HR decision makers, you don't have to go in and do that reimbursement every single month or add it to payroll. Our platform, when your employee has an eligible expense, our platform automatically reviews it, ensures that it's covered by your HRA plan, and then can actually get the reimbursement done in an automated fashion all through our platform. Now, for your employees, they're able to request reimbursements. We have, again, automated reimbursement review and approval. And then also all of your employees would be linking a bank account so that if they have a covered expense, their reimbursement is actually a direct deposit that they receive in their bank account. Now, as I mentioned, this is really what our process looks like to design the right HRA for your company, really identifying your goals, understanding your budget, and then understanding and helping you determine who's going to be covered and how much are you covering. I'll go ahead and skip that. I want to talk a little bit about this idea that we also have at Liferaft of modules. And so to make the process for our companies that we work with a little bit easier at the outset, we also have a number of what we call modules. And these are plan designs and structures that we have utilized with other clients or that we've seen have worked that really give us a starting point for you to be able to understand how an ICHRA might be the best fit for you. And so as an example, with a company here in the health insurance module, this company's goal would be they're really replacing group health insurance. They want to ensure that they're ACA compliant. And this kind of reimbursement budget is a good starting point to then be able to tailor to best fit your business. Now, a couple of things to keep in mind here. Number one, expenses covered. Again, that can be broad. It can also be very narrow where you're only covering health insurance premiums. The second thing to keep in mind is there are classes that can be added here. So it can be offered to only certain types of employees or different amounts to different types of employees, but you can also add certain wait periods that you would for your other benefits as well. So if you only want to be offering this to folks after they've been employed with you for 30 days full time, that's certainly something that you can do as well. So this is a quick look at what our platform actually looks like. If it is something that's of interest, I would definitely recommend, I'll put my information into the chat, but I would definitely recommend you reach out to us because I can give you a demo of the platform and what it would look like for your company, but really for our admins, we make an experience that's seamless, allowing you to add employees, offboard employees, and view what utilization of the HRA has been. Again, setting all of this up and program configuration for the platform takes under 10 minutes. So it's a very quick process. We can get the programs up and running very, very quickly. Now, for your employees, we also try to keep it, as user-friendly and streamlined as possible. The employees really want to be able to get reimbursed. And then second, I think are going to be looking for whether or not they've been paid. And so the employee experience is really designed to help your employees get paid quickly and to be able to submit for reimbursement. In terms of what the entire process looks like, once you've set up your company account, your employees receive a welcome email to join the Liferaft platform. That's where they accept or waive participation in the ICHRA. We then work with them to find and enroll in those health plans that are the best fit for them and their individual health exchange or their state exchange. They enter some contact information in, they link a bank account, and then they're able to, again, submit requests for reimbursements. Now, I think there was a question that popped up. Can expense reimbursement process be automated for ongoing expenses like premiums? Yes, it absolutely can be. That's really up to our company admins. We have a number that like employees to be uploading those premiums every single month to ensure that folks are continuing to pay the premiums and are staying enrolled. We have a number of admins that would like those to essentially be automated so that your employees aren't going in and having to request a reimbursement every single month. So both of those options are available through our platform. Now, I want to spend the last couple of minutes here, and then I'll open it up for any other questions that come up. But really look at a customer case study here. So this was a company that came to us that was on actually a level funded plan. So not fully insured, working with Blue Cross, level funded, and really their group plan premiums had gone up year after year after year. And that latest year, which was last year, they were actually looking at a 30% increase due to utilization by certain folks in their employee base. And so we're really looking for a solution to help save some cost here. And so it was a 35-person pass-through design firm based in Minnesota. We're about to get hit with that 35% rate increase. Really what they wanted to do was find, again, a way to save costs, but also ensure, one, that they were contributing about on par with what they had been doing with their existing group health insurance. And that was about 65%. And they wanted to ensure that their employees had quality coverage available to them. And third, they also had an HSA plan in place. And so they wanted to make sure that with the ICHRA, their employees that wanted to participate in the HSA and receive additional contributions from the employer into their HSAs were still going to be able to do that. And so we worked with this company, designed the ICHRA, and actually moved all of their employees over into the ICHRA. And really what we were able to do is, number one, on the cost saving side, we saved them $144,000 a year. So $12,000 a month that this group saved by transitioning from a group health insurance plan over to an ICHRA. They were on Blue Cross Blue Shield. Previously, they had Health Partners, which is a big carrier in Minnesota. If I look at all of the plans that we helped recommend and enroll all of these employees in health insurance plans. Half of those employees chose to stay with Blue Cross plans through the state exchange. Half of them actually chose to switch back to Health Partners because they liked their provider coverage better. So there's a really good distribution of providers here. The company also continued to offer their HSA. About 35% of their employees selected an HSA compatible plan. And that was something that we took into account at the time of enrollment, ensuring that we worked with every single employee to make sure if they wanted to continue contributing to the HSA, that we found them an HSA compliant plan through the marketplace. The last thing I want to mention here is when we looked at the company's prior contributions, which was 65%, and we looked at what it was after instituting the ICHRA reimbursement model that we designed for them, based on the plans that people ended up selecting, they actually ended up covering closer to 72%. And so given that difference in the price between the individual market and the group market, what this company did was actually increase the percentage that they were covering of health insurance premiums for their employees, but they were also able to save about $12,000 a month. And so pretty meaningful cost saving for them, but also continuing really good high quality coverage for their employees. Now, again, with this company, and one thing I want to stress is we provide kind of that support and service all the way throughout. So begins with a plan design, one understanding, hey, is an ICHRA even right for my company? Looking at and quoting for you. We go person by person on your census. We find the plans on the individual exchange. We create a reimbursement schedule, and then administering that plan. And then again, providing that support both through our technology, but also through our group of licensed health agents, providing every single employee the assistance when it in again, finding a plan that was the best fit for them, and then eventually enrolling in those plans as well. And then just very briefly, what does pricing look like on the ICHRA account? So for us at Liferaft, if you are under 10 employees, the price, there's going to be a $50 per month base fee, and then it's going to be $10 per employee per month. If you are over 10 but under 100, it's going to be a $10 PEPM, and that's going to be on per eligible employee. And so for that includes all of our design, the administration, enrollment as well. And so that's really, what I've got from a material perspective. Really appreciate everybody joining. I'm going to go ahead and jump to any last questions that we might have here. If you have any questions, please feel free to drop them into the Q&A. I think someone asked a question, Jason, do you pay commissions to agents who help you sign up new clients? That's a great question. We can work with brokers and agents, and we do that. There is a slightly different method that we use to do that, but there is an opportunity to participate in revenue. What I would recommend, Jason, is if you are an agent or a broker, feel free to drop me an email after this, and I can get back to you on the details there. Great. Any other questions? Again, please feel free to reach out to me. One of the things that I always recommend is, if you feel like an ICHRA may even be a possibility, please reach out to me. We will take a look at your census, what you're offering today. We can run the analysis and really help you understand whether an ICHRA is a viable solution for your business. And so again, if there's any level of interest, please feel free to reach out to me, and we would be happy to take a look for you. Great. So hopefully folks can see my email here in the chat. I'm going to go ahead and share that one more time, and I'll spell it out for everybody as well. So my email, my first name, Nimish. So that's N as in Nancy, I as in Indigo, M as in Mary, I as in Indigo, S as in Sam, H as in horse. And that's going to be at liferaft.co. So LIFERAFT.co. Great. Any final questions? Great. Well, thank you everybody for joining. We really appreciate it. And look forward to hearing from you.